Hi everyone, it's Dr. Campbell back with another ICD-10 CM coding guidelines session. Today, we're going to focus on Chapter 21. This is the last chapter in your tabular list. It focuses on factors influencing health status and contact with health services. So these are our Z codes. Z codes are actually not new to you because we actually looked at a few Z codes when we looked at the other chapters. Remember, in infectious and parasitic diseases, we had asymptomatic HIV infection. When we looked at neoplasms, those encounters for chemo or radiotherapy, those were Z codes as well. So today, we're just going to exclusively talk Z codes. One thing I would recommend is that you go to your tabular list and just spend time looking at all the different Z code options that are out there, because in my opinion, sometimes it's not obvious that a Z code actually exists. And so I believe that by you going to the tabular list, looking at the options that are available, then if you are reviewing your guidelines, that helps build greater awareness about the codes that are available. All right, let's go ahead and jump right in. So first, let's talk about use of Z codes. So Z codes can be used in any healthcare setting. Z codes can be principal, first listed, or secondary, and of course, as you know, it depends on the circumstances of the encounter. There are certain Z codes that can only be used as principal or first listed, and towards the end of our presentation, we'll talk about those Z codes that can only be listed as principal or first listed. And of course, principal when you're coding for the inpatient facility, first listed if you're coding for the provider or outpatient. Also, something that's very important to note is that Z codes are not procedure codes. If a procedure is performed today, you want to use the accompanying procedure code to support the Z code that you are capturing. All right, so as it relates to our Z codes, we do have different categories that have specific criteria that makes them unique to that particular category. There are several categories that you're going to say, oh yeah, that sounds familiar. And then other categories you're going to say, wait, I didn't even realize that there was a code option for that. So let's begin with contact and exposure. Category Z20 indicates contact with and suspected exposure to communicable diseases. These codes are for those patients who do not show any sign or symptom of a disease, but are suspected to have been exposed to that particular condition. Or it can be in an area where a disease is epidemic. Some examples of those categories are patients that are exposed to a sexually transmitted disease, and maybe they had sex with someone that may have a certain condition. So it's suspected contact or exposure. Next up, we have inoculations and vaccinations. Here we have a code Z23, and this is when a patient is coming in to receive a prophylactic inoculation against a disease. Of note, as a reminder, Z codes are not procedure codes. So a procedure code is required to identify the actual administration of the injection and the type of immunization that's given. So an example could be a patient that's coming in for measles, mumps, and rubella. This code Z23 can also be used as a secondary code In those situations where the inoculation is given as part of a routine preventative medicine service, such as a patient that's coming in for a well child visit. Status codes. Status codes are used to indicate that a patient is either a carrier of a disease or has the sequela or residual of a past disease or condition. This particular category of codes does include such things as the presence of a prosthesis or a mechanical device as a result from past treatment. Status codes are very informative because the status may affect the course of treatment and its outcome. A status code is very distinct from a history code. History code indicates that the patient no longer has the issue. Now, sidebar about this. Providers oftentimes will indicate that a patient has a history of a disease that they actually are currently still being treated for. And so as we work with our providers, it's very important to be sure and verify via the documentation and or querying the provider as to whether or not that condition truly is a history of, or if it is a status. All right, so now a status code should not be used with a diagnosis code from one of the body system chapters if a diagnosis includes the information that's provided by the status code. An example is with code Z94.1, which is heart transplant status. That particular code should not be used with a code from subcategory T86.2, which is complications of a heart transplant. In this situation, the status code does not provide any additional information. The complication code, however, indicates that the patient is a heart transplant patient that is having a complication. Now, there are other status codes. Again, I highly recommend that you go through the tabular list and familiarize yourself with all of the Z codes. But other Z codes that are here, there is a code for do not resuscitate status, DNR status. There are codes for when a patient is resistant to a antimicrobial drug. There's also Z codes, status codes for carrier of an infectious disease. Again, guys, please become familiar with those codes. Other codes, and we talked about some of these earlier on. BMI is considered a status code. We also have codes for long-term use. We saw that when we looked at our diabetes chapter. And then, guys, we also have codes for situations when a patient is allergic to a drug or a biological substance. Now, let me be very clear about this type of code. This code is saying the patient is allergic to XYZ. So for example, a patient can be allergic to penicillin. That's different than saying today a patient is having an allergic reaction to something currently. So that's not a status. That actually would be coded with a code from the table of drugs and chemicals, which we looked at in the previous chapter. Other status codes, and we'll move on from here because I know you're going to take a look at those code families. Another status code could be to identify the presence of a cardiac or vascular implant or graft. So an example of that would be a patient that has had a coronary artery bypass graft. And so again, building awareness about the codes that are available will help you with remembering that you can actually pick these codes up. History of codes. There are two types of history of codes, and those are divided into personal and family. Highly recommend that you go to your alphabetical index, locate the main term of history, and be able to clearly see where the personal history codes are and where the family history codes are, because that is going to make a big difference in code assignments. Personal history codes explain a patient's past medical condition that no longer exists and the patient is not receiving any treatment, but it could represent a condition that has the potential for reoccurrence and therefore may require continued monitoring. So for example, we have a code for history of breast cancer. Now, our family history codes are for use when a patient has a family member who has had a particular disease that causes the patient to be at higher risk for contracting that particular disease. Personal history codes can be used in conjunction with follow-up codes, and history codes may be used in conjunction with screening codes to explain the need for a particular test or a procedure. Again, highly recommend that you take a look at your alphabetical index, main term history. Under history, be able to separate out what codes are for personal, what codes are for family, and then just explore what the options are. Next up, we have our screening codes. Now, screening codes are for the testing of a disease in an individual that is well. And this is so that early detection and treatment can be provided for those who actually test positive. So for example, a patient that has a screening mammogram. If that screening mammogram identifies an abnormality, further testing can be conducted. The testing of a person to rule out or confirm a suspected diagnosis because the patient has some sign or symptom is actually not a screening. That is actually classified as a diagnostic exam. In the cases of a diagnostic exam, we're going to use the sign or symptom that explains the reason for the test. Screening codes can be first listed, but they also can be used as a secondary code. A screening code is not necessary if the screening is inherent to a routine examination, such as when a patient has a pap smear as part of a routine pelvic exam. The Z code indicates that a screening is planned, but you know, guys, we're going to need to have a procedure code to actually confirm that the screening was performed. And I always tell my coding students that CPT codes show what happened, diagnosis codes show why it happened, and we have to have that what and why to establish medical necessity. Next up, we have our observation codes. There are 3 categories of observation codes in the Chapter 21 section. These codes are for very limited situations when a person is being observed for a suspected condition that is ruled out. The observation codes, guys, are not for use if an injury or illness or any signs or symptoms related to the suspected condition are present. In those cases, you're going to report the signs or symptoms with a corresponding external cause code. All right. So observation codes are to be used as principal diagnoses. There are some exceptions to this rule. For example, when the principal diagnosis is required to be a code from category Z38. And this is that, I like to call this the hi, I'm here newborn code. In those situations, then a code from category Z05, encounter for observation and evaluation of a newborn for suspected conditions ruled out, is sequenced after the Z38 code. Next up, we're going to take a look at aftercare codes. Aftercare visit codes cover situations when the initial treatment of a disease has been performed and the patient requires continued care during the healing or recovery phase or for the long-term consequences of the disease. Aftercare codes should not be used if treatment is directed at a current acute disease. Now, guys, There are some exceptions. I think you are noticing that there are rules and then there are the exceptions to the rules. Some exceptions include our Z51 category, that's the encounter for chemotherapy or radiation therapy. Of note, the Aftercare Z code should not be used for aftercare for injuries. For aftercare of an injury, you are going to assign the acute injury code with the appropriate seventh character. And notice I said appropriate seventh character. You want to go back and review the rules for those 7 characters. The aftercare codes are generally first listed to explain the reason for the encounter. An aftercare code may also be used as an additional code when some type of aftercare is provided in addition to the reason for the admission, and in those situations when no other diagnosis code is applicable. So an example of this would be the closure of a colostomy during an encounter for a treatment of another condition. All right. Next up, we have follow-up. The follow-up codes are used to explain continuing surveillance following completed treatment of a disease. Now, one thing I will tell you about these codes, take a look at Z08 and Z09 just for an example to see the differences in the wording between these 2 codes, because a lot of times they're often mixed up just because of the wording. So the follow-up codes are explaining the continual surveillance following the completed treatment of a disease, condition, or injury. They imply that the completed treatment of a disease, condition, or has been fully treated and no longer exists. Now, these codes should not be confused with aftercare codes or injury codes with that 7th character that explain ongoing care of a healing condition or its sequelae. Follow-up codes may be used in conjunction with history codes to provide a total picture of the healed condition and its treatment. Your follow-up code is going to be sequenced first, followed by the history code. A follow-up code may be used to explain multiple visits, and should a condition be found to have reoccurred on the follow-up visit, then the diagnosis code for the condition should be assigned in the place of the follow-up code. Next up, we have our codes in category Z52 for donors of organs and tissue. These codes are to be used for living individuals who are donating blood or other body tissue. These codes are only for individuals that are donating for others and are not to be used when the patient is donating for themselves. Additionally, they are not used to identify cadaveric donations. So key here, guys, living individuals. Next up, we have our counseling codes. And counseling codes are used when a patient or family member receives assistance in the aftermath of an illness or injury, or when support is required in coping with family or social problems. Next up, obstetrical and reproductive services. Here we have a couple of things, and I do want to mention that there are specific guidelines for pregnancy, childbirth, and the preparium that you'll want to take note of. But here, these Z codes for pregnancy are for use in those circumstances when none of the problems or complications included in the codes from the OB chapter exists. So this is mom that's coming up for regular follow-up visit and life is good. All right, so codes in category Z34, and that's the category which is encounter for supervision of normal pregnancy, are always first listed and are not to be used with a code from the OB chapter. So think of it like this. You don't want to say routine or supervision of normal pregnancy when the patient has some complications that are impacting the pregnancy. Also here, guys, we have codes Z3A, which are our weeks of gestation codes. These codes are assigned to provide additional information about the pregnancy. Of note, the Z3A codes should not be assigned for pregnancies with abortive outcomes, elective termination of pregnancy, nor for postpartum conditions, because Z3A is not applicable to those conditions. The date of admission should determine the weeks of gestation when you have a patient that has an admission that encompasses more than one gestational week. Then we also have the outcome of delivery, Z38. This code goes on the maternal records only. It is a secondary code and it is never used on our newborn codes. Then here we also have codes for family planning or counseling on, and they should be included on the OB record during pregnancy or the postpartum stage if applicable. And some categories of codes that we have here, guys, are encounter for childbirth instruction, child care instruction. We have contraceptive management code families. Again, take a look at the Z code in section in your tabular list. Become familiar with those codes. All right, next up we have newborns and infants. Of note, we do have guidelines for newborns and infants. That's chapter 16. Here, what you're going to see from a Z code perspective, we talked about Z38, which is the "Hi, I'm here" baby code, which shows the place of birth as well as the type of delivery. But we also have, related to newborns and infants, our routine child health exam codes in our Z00.1 family. Then we have Z codes for routine and administrative examinations. These codes allow for the description of encounters for routine examinations, such as a general checkup or an examination for administrative purposes like a pre-employment physical. These codes are not to be used if the examination is for diagnoses of a suspected condition or for treatment purposes. All right. Also, during the routine exam, should the provider discover a condition or diagnosis, it should be coded as an additional code. Any pre-existing or chronic conditions and history codes may also be included, as long as the examination is for, emphasis on, guys, administrative purposes and not focused on a particular condition. Here we also have codes for routine health examinations, and something that's very important with these routine health examination codes, we have options for with and without abnormal findings. Our code assignment is really going to depend on the information that is known at the time of the encounter being coded. So for example, if no abnormal findings were found during the exam, but the encounter is coded before the tests are back, it is acceptable to say without abnormal findings because that's what we knew at the time of coding. When assigning a code for with abnormal findings, an additional code should be identified to identify the specific findings. So with and without. So if it is without, documented at the time of coding, we go with without. If there is an abnormal finding, we want to have an additional code to show what that abnormal finding is. Remember, coding is telling a story. All right, guys, miscellaneous Z codes capture a number of other health encounters that do not fall into the other 13 categories that we just went through. So some of these categories identify the reason for the encounter. Others just provide useful information on circumstances that may affect a patient's care and treatment. Examples are prophylactic organ removal. We also could have situations for persons entering health services for a specific procedure and treatment not carried out. So that's the situation where the patient has planned to have surgery. They're in the OR, something happens and it's not carried out. We also have our social determinants of health in this particular area. So problems related to physical environment, problems related to housing and economic circumstances, problems related to upbringing, just to name a few. And then, guys, we have non-specific Z codes. So certain Z codes are so non-specific or potentially redundant with other codes in our classification that there can be little justification for their use in the inpatient setting. And then in an outpatient setting, their use should be limited to those instances when there is no further documentation to permit us to use more precise coding. Otherwise, any sign or symptom or any reason for the visit that is captured in another code should be used. So some examples of codes here, we have Z02.9, encounter for administrative examinations, Z13.9, encounter for screening unspecified, just to name a few. And lastly, Section 16. This is where in your guidelines you are going to see a list of Z codes that can only be reported as principal or first listed, except when there are multiple encounters on the same day and the medical records for those encounters are combined. So some examples are, we mentioned earlier, Z38, which is the Hi, I'm Here newborn baby code. Also situations for donors of organs and tissue. We also have our encounter for administrative examination. Those are just some examples. Now I did want to leave you with a few lists of main terms that you can use to locate Z codes, because I have found that that's one of the challenges with trying to actually look up the Z code, is that we don't know what main term should be used. So here are, guys, a few examples, and you can obviously pause the recording and write down this particular list. And then here is a second list of terms, and they're in alphabetical order. And I do encourage you to take these terms. Definitely you want to check and make sure that they still are applicable. I've had this list for a few years now, and sometimes the main terms are updated, and so something may no longer be available as an option, but I know that you will take a look at the options that are available. Guys, thank you so much for listening, and have a wonderful day.